740 folks tonight. As of this morning, providers and nonprofits supporting an expansion of street outreach led by the Joint Office of Homelessness Services have been working to distribute over 2,000 hand warming packs, 400 hoodies, 400 pairs of sweatpants, 2,000 ponchos, 1,200 warm hats, 1,300 pairs of warm gloves, 2,300 pairs of socks, 2,100 wool blankets, 1,800 tarps, 500 tents, 500 sleeping bags, 2,000 Mylar blankets, and over 37,000 water bottles. The Multnomah County warming shelters are seeking community volunteers immediately and in the coming days. Anyone who is interested, especially those who have volunteered before and those with experience in human services and health-related settings, please join us. You can find a list of all the available shift opportunities and sign up to help save lives at our website, multco.us/cold, or by calling 211. Remember, if you're somewhere safe and warm, please stay there, but if you need to warm up, please come to one of our 10 warming shelters. Again, you can find the list at multco.us/cold or by calling 211. And please remember, 911 is for emergencies. If you see somebody who is down, somebody who is not responding, somebody who needs an emergency response, please call 911. For non-emergencies, for welfare checks, for checking in on people, please call the non-emergency line at 311. And then for information and connection to resources, please call 211. And next we'll have Alex from Do Good Multnomah to talk about the warming center operations. Thank you.
Hi there. My name is Alex England. I'm with Do Good Multnomah. I'm with Do Good Multnomah. We are currently operating the warming center in the Friendly House in Northwest Portland. We have capacity to serve about 65 guests, and our process is if you know someone that's needing shelter, they can come by here. If we're at capacity, we're partnering with the county and 211 to transport folks to safe, warm spaces. We're not turning anybody away. We're also partnering with the county to provide hot hands, warming supplies, food, water, everything that folks need to meet their basic needs, and just supporting them medically as well when the needs arise. So please keep supporting the community, send them our way, we'll make sure they get the supports they need. Thank you. I'll hand it over to Sarah from the county.
I can read a list of those shelters just to have it for your reference. So the sites that are open right now and that will remain open at least through 8 p.m. on Sunday, we're assessing every day to determine capacity. Those include Ascension Catholic Church at 743 Southeast 76th in Portland. That's operated by Multnomah County. There's a Salvation Army site at 5325 North Williams in Portland. That's also operated by the county. Market Street Shelter is at 120 Southeast Market Street in Portland, and that's operated by All Good Northwest. There's a Cook Plaza location at 19421 Southeast Stark in Gresham. That's operated by Cultivate Initiatives. We're here at Friendly House right now, 1737 Northwest 26th here in Portland, and it's operated by Do Good Multnomah. The Powell Shelter is at 7332 Southeast Powell, and that's operated by Transition Projects, Inc. And then the new sites that will be opening tonight at 8 p.m. Include First Christian Church at 1314 Southwest Park Avenue in Portland, operated by Multnomah County. The Freedom Foursquare Church at 660 Southeast 160th Avenue in Portland. That's operated by Multnomah County as well. The Multnomah County East Building at 600 Northeast 8th Avenue in Gresham will be open. And then the State of Oregon Building at 800 Northeast Oregon Street in Portland is operated by state employees. Again, we need volunteers to help for folks who can make it out here. We would certainly appreciate it. Please sign up on the website.
Alex, do you want to spell your name into the microphone so they can get your first and last name spelled correctly?
Yeah, my name is Alex England, AlexEngland.
Great, and we can open it up for questions now.
You mentioned someone passed away this morning. Can you provide more details on when that happened and what circumstances that person was in when you found them?
I really wish I could. I can't disclose any details right now. It's a suspected case of hypothermia, so we still need to do confirmation, which would take a few weeks. But I can just tell you that the person was found early this morning.
It's fair to say it was because of the weather, probably.
That's our best suspicion.
Was this a member of the unhoused community?
I also can't disclose that at this moment.
Okay, do you have any data so far about people who have been hospitalized due to weather-related exposure illnesses? In the last 24 hours, sorry.
Yeah, in the last 24 hours, I know we're seeing folks coming through our emergency rooms. I don't have the exact numbers on that. I could get that for you.
And with one suspected hypothermia death already, I mean, why is that so important to kind of ramp up your efforts to tell people these warming shelters are available?
Yes, absolutely. With any sort of morbidity or mortality, we want to make sure that we're doing the best we can to prevent people from getting cold and succumbing to cold. So these warming shelters are our best opportunity, I think, to make sure that we're getting people housed, warm, and safe.
Are there teams going around the area, Portland area, checking on folks and maybe transporting them to these warming shelters?
Yes, absolutely. We have a number of teams from our county Department of Human Services that's really going out trying to ensure that they're connecting people with these resources, telling them about the warming centers and trying to get them appropriate transportation to them. As was said earlier, TriMet will be allowing people to ride for free to any of these warming centers. There's also some efforts to try and utilize some of the car share programs, Lyft and Uber, to try and transport people who need it.
We're going to be below freezing for the next several days, so are these warming shelters going to be open for several days?
Yes, the plan is to at least through Sunday, and then we'll be evaluating every day to make sure we have the capacity and be able to continue to operate them as needed. Yes.
Can you explain what hypothermia does to the body and how people can prevent this from happening if they are outside for any amount of time during this?
Yes, definitely. So hypothermia is the onset of an extreme cold weather when people spend an extended amount of time outside. The body temperature drops, people can get confused, they can shiver, and they can pass out, and sometimes that can lead to unsafe low body temperatures that can cause death.
And how do you prevent that, though, like when you're out in these temperatures?
Yes. Well, these kinds of conditions can have an onset when people get very cold and wet, and it's also when it's very windy outside. So we want to make sure that people can get indoors, get warm, get out of wet clothing, and try and get warm blankets and other opportunities to warm up. Now, frostbite is when the fingers, toes, ears become very cold and pale and numb, and we want to reintroduce warmth to those body parts very slowly, not quickly with like heating pads or hot water, but to slowly warm those areas so that they can come back online.
And what are those signs to look out for when it comes to hypothermia?
Yes, the signs for look out for hypothermia include shivering, confusion, and sometimes people will get nauseous, sometimes they will get confused, lose consciousness.
Do you guys have any response for the people who just refuse to utilize these shelters?
Yeah, some people are not going to want to come in, and we get that. We're trying to make it as hospitable as possible. We're trying to also keep a quick eye on those folks who are our teams are going out every day to ensure that we can keep close eye on people, providing extra warm clothing and blankets, as we mentioned earlier, and help people stay protected as best they can.
Awesome.
I'm sorry, do you know why some people who don't feel comfortable or choose not to come to a warming center, like what are the reasons for that?
You know, everybody has their separate reasons. You know, it's hard to know exactly why people may not want to come in. We try to make it very comfortable for people, very accessible in multiple areas all around town. Some people may have a fear of sort of structured environment, and that's okay. We want to be able to provide extra materials and clothing for people who don't find a warming center to be the best place for them. But we want to try to make it as easy as possible to get to. Yeah.
I know there's a long list of warming shelters. Do you know approximately how many slots you have in total, and how many are already filled up?
Yes, so 2 of our warming centers from last night, 2 of the 5, did reach capacity. We're trying not to turn anybody away, so we'll do our best to accommodate. So I believe it was 350 people last night, and with adding 5 new warming centers tonight, we'll be at 740 people capacity. We're also working with our county partners in Washington County, Clark County, Clackamas County, because they also are opening warming shelters as well. So we'll be in contact with them if we have any kind of overflow needs.
Do you know anything about the unaccompanied youth who are unhoused and whether they are seeking shelter? And if they are, like where are they going?
Yes, I don't have details on that. I know that we take all comers. Anybody, any age can come to our warming centers. So we want to make sure that we have the capacity and the ability to take care of people and provide them with the resources that they need.
I'm sorry, which were those two that met capacity?
Shoot, I don't know exactly the number. I believe we were close to capacity here last night at Friendly House, and Cook Plaza and Gresham were the two that reached capacity. But we're trying to make more room and accommodation at both of those sites.
Okay, cool.
Is that still the case, by the way, that they're at capacity right now?
No, I think we'll be able to make accommodations, and like Alex said earlier, we're not going to turn anybody away. So we'll find a place, a space, or transport folks as needed.
Do you want to talk about frostbite as well? And concerns with frostbite and what to do to prevent frostbite?
Oh, sure. Yeah, I mentioned it a little bit earlier.
Okay.
Yeah.
Anybody have any questions about frostbite? I know we had a lot of questions about hypothermia. Yeah.
What are the first warning signs of frostbite?
Numbness. So frostbite usually comes to fingers, toes, and ears. People can feel numbness, paleness, and loss of sensation in those areas. So it's important to reintroduce warmth slowly. Mm-hmm.
What are some of the difficulties of introducing warmth to those areas for the houseless? So say like they can't come in. Like what are some ways you can recommend to slowly build up that warmth in those areas?
Yeah, so gloves are very important. Also, proper shoes, making sure that wet clothing is changed quickly so that it doesn't stay wet, and also drop even lower temperatures. We have hand warmers we've been giving out, thousands of hand warmers, to make sure that people can keep those body parts warm as easily as possible.
In cases of hypothermia, there are some cases where people actually shed clothing in hypothermia because they have a fake warm sensation. Can you describe that and why it's dangerous?
Yes, so people can get confused and sometimes take layers off in situations of hypothermia. But if we see people who are not having appropriate clothing outside, we're going to try and get people access to additional clothing so that they can put extra layers on and bundle up.
I know you asked for help volunteers. How do people inquire about that if they can provide their help?
Yes, we would love to have any volunteers at any of our shelter sites for people who can make it here safely. The way to sign up is online through our website, multco.us/cold, or by calling 211.
Can you talk a little more about the risk of death and injury from these conditions, and the risk of further deaths that might result from this weather?
Yes, because these conditions are so dangerous to people, we want to make sure that people are staying as warm and bundled as possible. Unfortunately, when somebody spends an additional time outside, they can risk dropping into hypothermic temperatures below 95 degrees Fahrenheit. Some people who may use drugs or alcohol also may be at higher susceptibility to the cold, which may also in turn cause problems with people losing consciousness and becoming deathly ill.
Is there anything else that you think would be important to add just about the overall efforts by the county and the county contractors, basically to help the unhoused population during this time?
Yeah, I think that we're mounting very quick efforts to make sure that we can really get an opportunity for anybody who needs a warming shelter to access it. So the fact that we're sort of doubling our capacity over the next 24 hours to ensure that people who need it can come and get access to it as quick as possible is really paramount. I've been really impressed with the coordination among all of the county staff and our partners in the community. We've really mobilized these efforts very quickly, or in very tight communication throughout the day on updates. Yeah, and I really appreciate you all being here today too. It's really, really helpful to get the word out, so thank you.
And I have one update. Hi everybody, Sarah Dean, Health Department, PIO. We heard from our partners at the Bureau of Emergency Communications, BOAC, that from 6 p.m. last night until now, they received 14 calls coded as cold exposures. So that can give you an idea of the sort of calls we are getting for transport to emergency departments from cold. So, and we'll try to include more information like that in our releases in the coming days.
Thank you.
Yeah.
Thank you.
All right. Thank you all for coming.